Difference between acute stress and chronic stress. Look at these pictures. Acute stress, chronic stress. Detail going on. Acute stress. It is a short term form of stress that occurs suddenly in response to an immediate threat, challenge, or pressure. Chronic stress, it is a long term form of stress that persists continuously due to ongoing problems or unresolved life situations. Difference between one duration. Acute stress lasts for a short period, usually minutes to hours. It ends quickly once the stressful situation passes. Chronic stress persists for weeks, months, or even years. It becomes a continuous state that affects overall well being. To onset, acute stress appears suddenly in response to an immediate challenge or threat. It is triggered by specific short term events. Chronic stress develops slowly over time due to unresolved or ongoing issues. It often becomes a part of daily life. Three causes: acute stress caused by sudden events like exams, accidents, deadlines, or arguments. The triggers is clear and specific. But chronic stress stems from long term conditions such as poverty, toxic relationships, or consistent work pressure. The causes are ongoing and repetitive. For intensity, acute stress very intense in the moment but short lived. The body reacts strongly but recovers once the situation is over. But chronic stress less intense at one time but constant. The prolonged exposure makes it more draining in the long term. 5. Symptoms. Acute stress produced immediately physical signs such as rapid heartbeat, sweating, and fast breathing. These disappear once the stress passes. Chronic stress leads to long lasting problems like fatigue, insomnia, frequent illness, and a weakened immune system. 6. Emotional effects. Acute stress causes temporary feeling of anxiety, nervousness, or irritability. These emotions fade when the situation is resolved. Chronic stress brings persistent sadness, hopelessness, and even depression. Emotional recovery is much harder. 7. Physical health impact. Acute stress usually harmless if occasional, as the body quickly returns to normal. It rarely causes lasting damage. But chronic stress increases the risk of serious conditions such as hypertension, diabetes, heart diseases, and digestive problems. 8. Cognitive effects. Acute stress can cause short term difficulty concentrating or remembering details. Once stress is gone, thinking return to normal. But chronic stress leads to long term cognitive issues like memory loss, poor focus, and reduced decision making ability. 9. Adaptability. Acute stress sometimes helps people stay alert and perform better in challenging situations. It can be motivating in small doses. Chronic stress, weakness, resilience, and coping ability over time, making even small challenges feel overwhelming. 10. Resolution. Acute stress ends quickly when the stressor is removed or solved. Recovery is usually fast and complete. Chronic stress rarely resolves on its own and continues even if the original problem challenges. It becomes a lifelong pattern. 11. Management. Acute stress can be managed with short term strategies like rest, relaxation, or problem solving. Relief comes quickly once addressed. But chronic stress requires long term approaches such as lifestyle changes, counseling, exercise, or medical treatment. Thank you. Have a nice day.